Is it possible to avoid gaining weight on antipsychotics? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And one of the questions that has come up is there any way to avoid weight gain on antipsychotics, or is it just inevitable? So first of all, I'll say that, of course, not everyone is going to gain weight on the antipsychotics. Sometimes you're going to have that really skinny individual who's on 800 milligrams of Seroquel and they don't gain a pound. Whereas you may have someone else who's on a tiny dose of Abilify and they gain 30 pounds. So a lot of this has to do with an individual's unique metabolism and the effect that the drug produces. That being said, you're not powerless when it comes to the weight gain. There are certainly things that we can do to mitigate that risk. Of course, number one is going to be lifestyle interventions, making sure that you're mindful of what you're eating. Additionally, being mindful that you're exercising regularly and staying active. Of course, these things are easier said than done. However, they are going to be beneficial for your mental health in general. So I would recommend working on these habits even before you start a medication like this. Now, of course, there are still people who do their best to make these lifestyle changes or to continue with these good lifestyle habits, but they're still struggling with weight gain. Or I certainly have had a lot of cases where the person is just too cognitively impaired, or they don't have the executive functioning to be able to implement the lifestyle strategies that I counsel them on. So my preference would be, of course, to decrease the dose to a better tolerated dose, or to switch the medication to a better tolerated medication. But sometimes this isn't a great option depending on the potential risks of the illness for that individual and, of course, the past medication trials that they've had. If a patient has to stay on that dose of a medication in order to stay safe, and they continue to gain weight and have worsening metabolic markers despite their efforts or due to their limitations, then there are some medications that we can prescribe. So recently, actually in 2025, a new guideline came out that recommends prescribing metformin, which is a medication we use to treat insulin resistance, along with certain antipsychotics to prevent weight gain. So for some medications, the guidelines recommend that you just start it prophylactically. So if you prescribed olanzapine, prescribe it with metformin. Like, those two prescriptions should go hand in hand. Whereas others would say, oh, only if they have a significant weight gain or if they have pre-existing metabolic risk factors, which, let's be honest, most people do. So metformin is certainly one option. There's also a lot more data coming out about the use of GLP-1s in this population. And everything that's been coming out recently essentially says that they're safe and effective as far as preventing or reducing weight gain and negative metabolic effects. Obviously, when talking about the lifestyle and dietary interventions, there are so many things that we could talk about. So I can certainly do another video on that as far as things like intermittent fasting or what macros to focus on, etc. But I will save that for another video. If that's something you want to learn more about, then let me know in the comments. Also, I'm putting together an email list for those of you who are interested in my content, because I may have future courses or offerings, and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email, and I'll see you in the next one.